Hey, Dr. Drew here with Inspire Cosmetic Surgery and Med Spa. Welcome to another edition of Inspire Insights. We're going to speak today a little bit about rhinoplasty. Rhinoplasty is a highly technical procedure that is very specialized and has to be tailored specifically to the patient that's getting the procedure. It is extremely important. I cannot stress enough how important it is to make sure that your surgeon is board certified by the American Board of Plastic Surgery, especially when choosing a procedure of this nature. Nobody wants their face in the hands of somebody who doesn't have a level of experience of over 30 years combined experience with the surgeons at Inspire. When you're choosing a surgeon to do your rhinoplasty, you should be extremely well informed on the different nuances of rhinoplasty and also about the functional aspects of rhinoplasty. I'm just going to point out a few things for you to know when you're considering having your surgery performed and where to go to have that surgery. So if you look at a typical nose, it has a number of different features. We call this area the dorsal aesthetic lines. What people are frequently concerned about is a hump on the dorsum of their nose. A lot of times people complain about the shape and position of their nasal tip. Sometimes the tip is too pointy, sometimes it's too bulbous. We talk about the lower lateral cartilages are the ones that make this definition down here, and the upper lateral cartilages, the one that make this definition here. We also talk about the supratip break, or how the nose turns up at that position. And we also talk about the width of the nose. It's very important, and it's easy to understand some of these things when you're speaking to a fellowship-trained craniofacial surgeon about what to appreciate when you're considering having a rhinoplasty. So you also need to take into consideration the lip, the length of the lip, the position of the lips, the relationship of the nose, the tip of the nose in relationship to the upper lip, the lower lip, and the chin point. A lot of times the bite is not proper or the chin point is not in the right position. All of these things significantly affect your outcome for rhinoplasty. When we do this procedure, we make a minimal incision across the very narrowest base of the nose to ensure that your incision is hidden. All of the other incisions are internal and cannot be seen, hiding your outcome from your surgical procedure. When looking internally at the structure of the nose, it's extremely important to ensure that the surgeon that you're seeing evaluates you from a functional standpoint as well. The breathing is critical when it comes to rhinoplasty, and you do not want to sacrifice the flow of air and your comfort in breathing for your aesthetic outcome. Both of those things need to be accounted for. And so when you're looking at the internal structures of the nose, there's actually internal nasal valves. This is the septum of the nose, or the part that divides the two nostrils. This is cartilage in this area, which turns into bone. And this is cartilage that form the sides or roof of the nose, which we refer to as the upper lateral cartilages. This angle in this area needs to be 15 degrees or greater. If that angle is not 15 degrees, the nose tends to collapse when you're breathing. So it's critical to have this evaluated and to ensure that your surgeon is able to configure this during surgery and do the appropriate grafts and necessary measures to ensure that your breathing is corrected while you're having your surgery. These are the inferior turbinates, or the areas of swellings that make the air circulate inside of your nose. They moisturize or humidify the air as you're breathing it in. And these structures, while important, can cause a significant amount of airflow issue. So these need to be attended to during the surgery as well. And frequently, the septum can be deviated, causing issues with airflow in one or both sides of the nostril. This also needs to be addressed during surgery if you're having functional breathing problems, as well as the aesthetic aspect of treating the nose. which should be treated hand in hand. So these are some of the reasons to ensure that the surgeon you choose has a vast experience with rhinoplasty, secondary, tertiary rhinoplasty, having very comfortable experience doing these multiple times in patients that may come from outside that need redo surgery or primary surgery. Be inspired.